You're watching Byline Wilmington on CBS 10 WILM. Here's your host, Don Ansell.
We're back. Our guest is Dr. Marcia Fretwell. She's a local physician, very outspoken on this issue of health care, and we're going to talk about a lot of issues related to this. But let's talk about the insurance industry, Dr. Fretwell. How much responsibility does the insurance industry bear for the issues, the problems we're having in healthcare now?
Well, there have been some past patterns of behavior that actually seem to have survived healthcare reform, such as only taking healthy people into your insurance program to reduce your need for expenditure for sick people, cherry picking. Cherry picking is a great way to increase your profits.
Well, sure.
And I do think actually one of the strengths, and I don't hear people carrying this through, but as far as I understand it, the current health care reform, this has stayed in there, that there will be restrictions on cherry picking, there will be restrictions on dropping people after they...
And pre-existing conditions.
And pre-existing. So I think they've, in fact, stepped up to the line on some of those reforms that have been very necessary.
I did a little research, and I found that the health insurance sector of the insurance industry shows some of the lowest profit margins in the entire insurance industry.
Well, because we may be spending too much money on tests and procedures that people don't actually need. It's very expensive what they're insuring. And you actually mentioned earlier, I don't think, if this is a business and patients are consumers, they have no idea what they're paying for what they're receiving. Now, what kind of business relationship is that?
Let's examine this a little bit. I had a procedure a while back. It was a pretty major healthcare procedure, and you have an entrance interview where they explain what's going to happen, and then they ask you, have any questions? And I said, yes. How much is this going to cost? And the person interviewing me gave me this very strange look, and she said, do you mean how much is this going to cost you? I said, no. What is the cost of this whole procedure that I'm going to have? It was almost a 2-month process. And she gave me the strangest look, and I said, is that an unusual question? She says, yeah, nobody ever asks, how much is it going to cost?
And she probably...
And she didn't know.
She didn't know the answer.
She said, I'll have to research it.
Right.
Well, somebody has to pay for it. There is a definite cost, and somebody has to pay for it. Now, I realized I had insurance. I wasn't going to pay but I did want to know because somebody has to pay for it.
Well, that brings to mind the issue about autonomy versus dependency. And I'm not a great believer that any of us are truly autonomous. I think we are all interconnected with each other. And Wendell Berry, who's my favorite agrarian philosopher, says there really is no such thing as autonomy. There's just responsible dependency and irresponsible dependency. And you were trying to be responsible in your dependency. You still had the insurance, people were taking care of you, but you were trying to be responsible. And I commend you but unfortunately, we've not put that incentive into...
Well, we've forgotten.
Yes.
It costs what it's going to cost me, but I knew that wasn't the cost. And is that, with that loss of thought, has that damaged our system?
Yeah. I don't think you can go 3 or 4 different places and get 3 or 4 different prices that have nothing to do with the value of the service that's being provided. I think in usual businesses, there's a shared perception of what the value is, and the cost is related to that. It might be related to the cost of actually producing it.
Well, let's talk about healthcare costs. And I have another little scenario. A friend of mine recently had a routine colonoscopy and endoscopy. That's, for lack of a better term, that's where they go in both ends and check out what's going on. It was routine. It was done in about 3 hours. He got the bill, and it was over $6,500. It was like a 3-hour procedure. He did have to go under anesthesia. And he was like, he's in the healthcare industry, and he was shocked at $6,500 for like 3 hours. And the expertise and the equipment, but what's going on there?
Well, that conceivably was a preventative maneuver.
Correct.
Okay. So
Routine, though.
routine preventative. So everybody, as they reach a certain age, in theory, is supposed to receive that treatment. That would break the bank completely if everybody stepped up to the line and said, this is what everybody needs, and therefore we. And I think we're seeing some modification of that. But the way I approach prevent and cost, I can't comment on how much it costs, because it obviously is related back to how much it's costing that organization to provide
operate.
to
Right,
operate.
yeah.
What their overhead is, what they're paying out in salaries.
Plus profit.
Plus profit.
Right.
But I think
it just seems so expensive
I think
for
it
a
is,
routine operation.
It is, and you have to ask
Procedure.
the question, and this is something, you know, they have these cross things where they have quality and effectiveness, and you're trying to say, well, you know, if the goal would be 100% people were screened, that's beautiful quality, but it may be far beyond the cost. So then what's the next approach? And it's not perfect, okay, but if you select people who are at risk for colon cancer, then you know you're going to narrow that group down a little bit. If you, after you screen people and they don't have any sign of it, then you let them off or go to a less expensive way of screening over time. So, but we've not done that kind of balancing.
Like mammograms, that issue recently came up. They tried to skew it so that everybody didn't have a mammogram unless they were at high risk, and there was a huge outcry, and a lot of people stepped up, a lot of consumers stood up to the plate and said, if I hadn't had a mammogram, I'd be dead, but I didn't have any high risk factors. Are you advocating that we go in that direction?
It's not a question of advocacy, it's a question of, I don't see how we're going to provide coverage to everybody unless we start looking at incentives and we look at different ways to accomplish what we need. We need to be screening women for breast cancer. That's, no one argues that. Exactly what is the difference between monthly self-exams and mammograms in terms of detection? And it turns out, I think, my last reading was that monthly self-exams are very beneficial in finding, in fact, do it earlier than mammograms. But again, I'm back to responsible dependency. Are women responsibly examining themselves every month to make sure that we catch that first round? It's easier to take pills. It's easier to get tests. It's a one-time shot, okay? But the truth is, there have been many women who've had mammograms and within 6 months show up with a tumor. So nothing's perfect, and so we have to struggle with that imperfection.
We're going to come back and talk more with Dr. Marsha. Well, when we come back, we're going to talk about something that she and I, growing up, went to the doctor. They gave you a prescription, you went and got it filled. Now they're advertising, the medical companies are advertising prescription drugs to the public. We'll talk about that when we come back. Stay with us.